I'm Dr. Charlie Baker, and I'm a family practice physician just upstairs from the YMCA here in Avery County. I'm very proud of what the YMCA has accomplished in this community. In the 32 years that I've been here, I think the YMCA has done more for preventive health care in Avery County than anything else that I've seen. As a board member of the Y and as a member of our healthcare community, I'm committed to helping the Y be more available and more affordable to every member of our community. The facility is fantastic. We've got all the equipment, all the trainers that we need to help our community. The thing that impresses me most, though, is we see people that have never been active before that are starting to get healthy now. They have a winter way of exercising, which they've never had before. The facility's great, the staff are great, and we got people getting healthy. This Y serves everybody. We have a sliding scale for people that have a hard time affording it. We have scholarships available. The monthly fee is reasonable, but if you can't meet that fee, then we have ways of helping out. The hospital YMCA partnership has been just a great synergy. The hospital wants to have a sort of a foot in the door for preventive health care too. They're helping the Y, having the Y here helps our community to be healthier. It's just a great team effort. The value of exercise is something that I've been emphasizing to my patients for years. I just don't see diabetics, for instance, getting in good control without some form of exercise. People with mental health issues, every day of my career, I say these words. If you're burning up physical energy, you're burning up nervous energy. Having that exercise can help with anxiety, with depression, all kinds of mental health diseases. It can help, of course, with hypertension, diabetes, just overall fatigue. So I think it's great to have that regular source of exercise, and the convenience of the Y makes that great. Having a spiritual basis for the Y, I think, is very important. Most everyone around here is very spiritual, and most everyone around here are Christians. But you don't have to be a Christian to come to the Y. They're accepting of every faith, every spiritual idea. But spirituality is important for health, both physical and mental. It's important to have the mind-body synergy too for your health. I've been an exercise fanatic for years. I was a marathoner until the orthopedic issues made that a problem. Now I'm a cyclist. I'm on my bicycle 8 or 9 hours a week with probably one of the busier schedules of anybody around here. I wake up every day trying to decide then when my exercise is going to come. I'm mostly out on the roads this time of year, indoor biking during the inclement months. Some of that at the Y, some of it at home. Every week though, I'm here at least 2 days a week for sure, with some upper body strengthening activity, sometimes using the aerobic training facility as well.
And you make friends here?
Oh yeah, these the staff here are great, and in the 32 years I've been here, patients have become my friends, and vice versa.
Can you tell me a kind of a broad stroke story of some patient that you've had that has had a positive turn because of the Y?
Yeah, I can. There are several, but the one that comes to mind is a patient who was diabetic, had never been a big exercise person, but she has gotten motivated and has been exercising every day. She was overweight to start with. She's lost 50 or 60 pounds. Her diabetes has become almost undetectable now. We can tell she's still a diabetic, but she's healthy, feels good about herself, her self-esteem has climbed, her health has improved, and I have multiple cases like that I could share. For years, I've watched people get active in springtime, summertime. They're in their gardens, they're walking, they're playing with their kids outdoors, but by October and when we lose daylight savings time, they hunker down. And people get inside, they lose some of the health benefits they've gotten from exercise during the summer months, and they gain their weight back and they lose that aerobic condition, and come spring, they have to start all over. Having the YMCA here has helped people to stay healthy year-round.
It provides an opportunity they didn't have for those 5 or 6 months of the year, or 4 or 5 months of the year.
Yeah, before the Y was ever here, I told my patients, you need to be planning now in May what you're going to be doing to stay active come November. You need to have an indoor way of exercise. Everybody in this community needs that. It gets too cold, too inclement, too snowy to stay healthy with outdoor exercise during the winter months. Having the Y here has made it easy. I can just tell people, hey, right downstairs, you've got a way of staying healthy all winter long.